Hello, my name is Jennifer Benitez. I am a graduate nursing student at Eastern Kentucky University, and today I'm going to discuss a non-pharmaceutical intervention, specifically an exercise program for pre-diabetics or patients identified as pre-diabetics. Type 2 diabetes is rising globally and is a common cause of morbidity and mortality. In the United States, 1 of 3 adults have prediabetes, and many of them are not aware that they do have prediabetes. With lifestyle interventions, an individual can make changes that can decrease their chances of being diagnosed with diabetes. The theoretical framework that I used was Nuala Pender's health promotion model. It was developed as a theory to assist nurses in understanding factors of patient health behaviors in order to serve as a starting point to optimize behavioral counseling and promote healthy lifestyles. The assumption of the health promotion model is that people want to create conditions where they can express their unique health potential. This includes their ability of assessing their own competencies and seeking positive growth. This also includes their perceived benefits of action, the barriers that they may have, and what they believe they can do. In the health promotion model, health professionals are recognized as part of that environment. However, self-initiated reconfiguration of the person-environment interactive patterns is essential for behavioral change. The individual must play an active role in shaping health behaviors and modifying environment. So they also have interpersonal influences. Like I just said, health professionals are a part of that. Also family, peers, culture, social support, also the situational influences. And it all comes down to a commitment to a plan of action of the patient, which will ideally, hopefully, continue with or participate in a health promoting behavior. The question I started with was, when I started my research, was in adults identified as high risk for developing type 2 diabetes, how does participating in a weekly exercise program affect blood glucose levels within 3 months? And the study findings, I found that it appears that it does. Study findings by Rezk Allah and Takla revealed that a weekly exercise program does indeed decrease A1C levels after participating in a 12-week exercise program. They had high intensity interval training, which is for short HIIT. And they did a high volume and low volume. The high volume group actually had a reduction of A1C by 26.7%. I also found a systematic review with meta-analysis by Jodhoff that found that pre-diabetics who participated in a physical activity intervention showed a favorable effect on A1C. And also an article by Schmidt, I found that a new diagnosis such as prediabetes can alter an individual's health image, which could initiate them to make a positive health behavior change. Also, group physical activity interventions provide the social support and tools that some patients may need to help them overcome barriers. The plan, it was first to find a team to help me with my project. This would include advanced practice nurses, a phlebotomist, a nurse or nurse aide or nursing students, physical therapists, an exercise specialist or administrative assistant, and someone for data analysis. We would also need to identify individuals who were pre-diabetic, which would be an A1C of 5.7 to 6.4% and inquire if they were interested in participating in a non-pharmaceutical intervention such as a 12-week exercise program. We would first obtain baseline data on patients who were identified as pre-diabetic, and I would want BMI, A1C, and their feelings about their individual health. The plan was to make a specific exercise plan of 40 minutes a day, 4 times a week, and this would be an individual exercise program, and it would be determined by a physical therapist or exercise specialist. We wanted to be sure that everybody was included. Some people don't participate in exercise because they have chronic pain such as back pain or shoulder pain, but we wanted to let everyone participate. So the physical therapist would assess those patients, and exercise specialist would make the plan for the rest of the participants. The program would also consist of a bi-weekly meeting with the personal trainer or physical therapist, a weekly phone call from staff just to see how the participant was doing, if they had any questions, and to allow some encouragement. It would also include a monthly meeting in person with all of the participants in the program. In person is encouraged, but Zoom is okay too. An A1C will be drawn 12 weeks after the individual begins the program, and we would inquire if they wanted to continue in a program such as the exercise intervention program. If they'd like to continue, hopefully we'll have funding for that, where they could continue to see a physical therapist, and then weekly or bi-weekly appointments with a physical trainer. A1C, that will be utilized for measurement of outcomes. Timeline includes the first month we'll have our interprofessional team meeting. We'll identify and recruit our patients with the A1C to 5.7 to 6.4%. We'll collect the participant data. That includes A1C, BMI, feelings about personal health. The exercise program by the physical therapist or the exercise specialist will be done before the program starts. That will be there 40 minutes of exercise 4 times a week. Bi-weekly sessions to evaluate feedback will begin the second month. Again, we'll have the interprofessional team meeting monthly. When the program starts, the bi-weekly sessions to evaluate, then they'll get feedback and possibly new exercises. Weekly call and monthly participant group meeting. That will be through the 12 weeks. After the 12 weeks is finished, we'll again collect participant data, the A1C, BMI, and the patient's feelings about their personal health. After we collect all of our data, we will evaluate and disseminate the data. From there, hopefully we can get some feedback from our participants and see our data and see what improvements we need to make, any sort of adjustments, and then maybe we could implement the program to more parts of the community. Thank you for your time.